We have now seen, we were just checking to see if Senator Tim Kaine was on the Senate floor. And when we checked it, we saw another familiar face, and this is Democratic Senator Mark Warner. So he is currently speaking before his colleagues on the Senate floor. I do not know what he is speaking on today, but we're just going to go ahead and take him and see, and then we can hopefully provide a little bit of context if needed on the back end of this. But let's go ahead and listen in. This is Senator Mark Warner right now on the Senate floor.
I think we can get this done. We've seen my Republican colleagues stand up to the president on the Epstein files, on war powers, and just in the last day or so, the attack on the independence of the Federal Reserve. Let's have that pushback extend now to healthcare costs. Let's help keep millions keep their healthcare today, and then work together towards a long-term sustainable plan to keep healthcare costs stable for the next decade. Before I yield the floor, I want to also acknowledge this is something that a lot of us have been working on. Senator Klobuchar does such a great job on so many issues. Senator Wyden, who's our leader on the Finance Committee, they and others will come today to speak on this issue as well. I hope my colleagues are listening, and I hope they will actually acknowledge we got to bring healthcare costs down today. This isn't a full solution, but at least it's an action that we can take today. So with that, Mr. President, I yield the floor.
Thank you, Mr. President, and I want to thank Senator Warner for his tremendous leadership on this important issue that is just really tormenting so many Americans right now, as well as Senator Wyden. This involves tens of millions of Americans who are facing a healthcare crisis. Their premiums are doubling or tripling, and it is completely in our hands to do something about it. Open enrollment is ending in 2 days. Americans across the country are looking at their budgets and facing this difficult choice of whether to pay double or triple for coverage or go uninsured. And why are tens of millions of Americans facing this reality? Well, because congressional Republicans failed to act, to come to the table, to negotiate an extension of the Enhanced Affordable Care Act tax credits before the end of last year. Last Thursday, the House passed legislation to extend these health care tax credits for 3 years. 17 Republicans joined Democrats. You think about it, they could have done that months ago. Months ago. We were willing to negotiate with them 3 years, 2 years, 1 year at the time. They wouldn't do anything. And now they've realized, I guess they didn't understand what was happening to their constituents when 20-some% of farmers and ranchers are on these kinds of policies, and 75% of them are in red states. This legislation that Senator Warner and Wyden have proposed is simple and reasonable. We're simply saying let's make sure the same tax credits that make care more accessible for tens of millions of Americans yesterday and last year and the year before that continue to be there for families this year. Americans are looking for us to act, and the time to act is now. I've heard from people across my state in what is a very, very difficult time right now in the state of Minnesota, with the arrival of ICE on our streets, with people terrified, with the chaos that has ensued. We are still hearing from people about health care all the time. Nikki from Waseca wrote to me that the health care premium for her and her husband almost tripled from $862 a month to $2,344, which over the course of the year is more than her annual salary. She called the increase insufferable. Nadine from Sartell, a 53-year-old single mom, shared that she has a master's degree in social work but lives nearly paycheck to paycheck now because her housing and utility costs eat up over half of her monthly income. And unless Congress renews the health care tax credits, she's not going to be able to purchase health care. Of course, there's only 2 days left. And here's the kicker. Just 4 months ago, she was diagnosed with breast cancer. She's already used up nearly all she has in savings for the copays and coinsurance to get a diagnosis and receive treatment. Another constituent, a school bus driver named David saw his premiums double. He's now spending 12% of his total pre-tax income on health insurance. David wrote that it's difficult and frustrating to see life crumble before your eyes, just trying to get ahead and just to find setbacks waiting for you. I would like Congress to actually sit in real life people's shoes for just a while to see how it feels. I hope we can get something changed. That is a bus driver in Minnesota begging our colleagues on the other side of the aisle to stand and sit in his shoes. Because if Congress can't fix this, David shared with me that even though he works full-time, he will have to give up his health insurance entirely. The rules that Senator Warner and Senator Wyden and others of us have suggested do away with the caps that limit how much of their income people like David must spend on health insurance. And so as we work to extend the health care tax credits, it's critical that we stop the administration from further undermining the Affordable Care Act and raising costs. And this just isn't happening in my state, as I know 3/4 of the people who get their health coverage on this ACA marketplace live in states that President Trump won. We know the stakes, and we must come together to solve this affordability crisis. And I will note that the amount of money given to Argentina was approximately the same amount it would take to fix this for 1 year. There's a lot more work to be done to lower health care costs. Medicare price drug negotiations that I have led for years and making sure that's really happening under this administration, reforming prior authorization, making improvements, public option, we go on and on and on. But right now, we have one crisis that is hitting so many Americans, and we have a way to fix it. So I urge my Republican colleagues to join us to stop Americans' health care premiums from skyrocketing and simply bring to the Senate floor and pass the bipartisan House-passed bill to extend the health care tax credits that Americans rely on, and of course, to vote for SJ Resolution 84, which is in front of us today, and we thank Senator Warner and Wyden for leading the effort. Thank you, Mr. President. I yield the floor.
President,
Senator Morgan.
before she leaves the floor, I just want to say that the senator from Minnesota has been relentless in terms of standing up for folks who are just trying to get a fair shake on their premiums. I've been doing this since my days with the Gray Panthers, and I know what it means to be persistent. That defines Senator Klobuchar, and I thank her. I'm pleased to be working with Senator Warner and Senator Ossoff. I see Senator Kaine here, because all of us want to make sure we lower health care costs for American families. Today, the Senate's going to vote to repeal a host of damaging policies that Donald Trump, Robert Kennedy, and Dr. Oz have unleashed on Americans who are unsuspecting. People who are just trying to get by in tough times are going to get hammered. And from the day Donald Trump was sworn in, this administration made attacking Americans' health care their top priority. Last summer, Republicans in Congress rammed through a massive bill to give tax breaks to billionaires and giant corporations while making the largest health care cuts in American history. At the same time, the Trump administration used the Byzantine federal rulemaking process to double down on these efforts by finalizing the rule that all of us on this side of the aisle are working to repeal today. The harmful changes made by the Trump administration come down to one proposition. It's okay to have more red tape, and it's just fine to increase health care costs. That's the exact opposite of our agenda, which is to focus on affordability and making the American health care system simpler. I'm going to just tick through a couple of the worst examples to illustrate why these rules need to be junked. First, the Trump rules will increase what American families have to pay out of pocket each year by nearly $1,000. So the question becomes, Mr. President, what's the purpose behind that change other than to take money from Americans who are already struggling? The rule adds new fees, such as the new re-enrollment fee that applies to low-income workers. To be clear, that means if you want to keep your health insurance, you got to pay a fee to the government just for the right to keep what you've got. Even by Washington, D.C. standards, I say to my friend from Montana, that just defies common sense. They also create mandatory minimum premiums that are going to cause millions to lose their coverage. Now, Republicans say that these fees are aimed at reducing fraud. There's just no evidence to back it up. My view has been, ever since my days with the Gray Panthers, and my friend from Virginia knows about this, I say any fraud is too much. But the numbers are clear. The vast majority of fraud in healthcare is conducted by shady insurance brokers who are looking to make a fast buck through commissions from phony enrollments, not working Americans looking to buy healthcare. So I've introduced legislation to create tough criminal penalties for these insurance brokers. So make no mistake about it, Senator Kaine, there's something we ought to be doing to root out fraud. Let's go after these insurance brokers with tough criminal penalties. I've been talking to Republicans to ask them to join as co-sponsors, and they haven't been willing really to give us the time of day. Instead of going after fraud where it exists, Donald Trump and Republicans create barriers that are going to trip up Americans trying to navigate a healthcare system that's just too complicated. Beyond fees and higher premiums, the Trump rule also adds new verification checks and enrollment rules that amount to an enormous heap of red tape. These red tape measures, according to authorities who've analyzed it, is going to create 15 million hours of paperwork. 1.8 million people are going to lose their coverage as they try to navigate this never land of a maze of healthcare rules. These types of changes are right out of the playbook of big insurance because they create barriers and bureaucratic hurdles so they keep more of your money while denying working families basic health care. It's no secret that Americans have had a belly full of a health care system that gets in their way at every turn. It's time for Republicans to do the right thing and join with Democrats to lower Americans' health care costs instead of creating new cost barriers and red tape restrictions. They can help those families by voting with us today. I urge my colleagues to support Senator Warner and Senator Ossoff, Senator Klobuchar, Senator Kaine. We're all here for one purpose: less bureaucracy, less red tape, lowering premiums for families. I yield the floor.
Mr. President.
Senator Virginia.
Mr. President, I'm glad to join my colleagues to talk about the upcoming vote on Senate Joint Resolution 84, the use of the Congressional Review Act to strike down a recent regulatory attack on the Affordable Care Act launched by the Trump administration. I think my colleagues have done a pretty good job of explaining what's at stake. Even the Trump administration's own experts at CMS, the Centers for Medicaid and Medicare Services, say that implementation of this rule could lead up to 1.8 million people to lose health insurance just this year, 2026. That would be devastating. On top of the premium increases that people have seen because the Affordable Care Act extended tax credits were not extended when tax cuts for the wealthiest were extended, this additional burden on this 1.8 million person population is unacceptable. And the vote we'll cast today gives us all an opportunity to sort of shore up the healthcare network for that nearly 2 million people. I wanted to focus in particular on a kind of person who is really going to be affected by the Trump rule if we do not affirmatively embrace this Congressional Review Act resolution, and that is self-employed entrepreneurs and gig workers. You know, one of the challenges about the American healthcare system before the Affordable Care Act was it was very, very difficult to buy health insurance if you were an individual entrepreneur, if you had a very small business. Without exchanges and the offering of policies on the exchanges with premium support for those who were lower middle income, you had a lot of people who were self-employed or entrepreneurs who couldn't buy insurance at all. And then you also had a huge group of people working with companies that had insurance that had this great American dream of an idea to start their own business, but they couldn't do it because if they were to leave their large employer to go off and follow their dream, they couldn't get health insurance. And one of the very salutary effects of the ACA,
through the creation of exchanges with premium support has been to enable people to pursue their dream and become innovators or entrepreneurs or gig workers and work in the way and in the flexible circumstance they choose. And Mr. President, I speak from experience because 2 of my 3 kids fit into this category. The rule that has been put in place by the Trump administration isn't going to make it particularly hard for large group plans to just re-up insurance, but it will make it very hard for those individuals that don't have an HR department fighting for them, that have to figure it out all on their own. It will make it very hard for them to negotiate the marketplace and buy insurance. And sometimes their income is up, and sometimes their income is down, and sometimes they want to enroll, and at other times they don't. It's precisely this kind of person that is going to be hit the hardest by the Trump rule, and why I'm so strongly in support of my colleagues' efforts to repeal it. You know, we often say, Mr. President, and I'll conclude, that small businesses and startups are the backbones of the American economy. And they are. I grew up in a house with a dad who worked for a huge company, and it was his dream to start his own business. And he bought a little ironworking shop that at the time that he bought it had like 4 employees. And during the entire growing up period where I worked in my dad's shop, in a good year it would be 7 employees, and in a bad year it would be 4, plus my mom and my 2 brothers and me. So many American businesses are just like this. They're 1 or 2 employees. There's somebody who even has another gig, maybe as an artist, and then they're moonlighting in some area where they can make just enough to afford to buy health insurance on the exchange, if we don't crush them with high premiums and if we don't make the paperwork burdens so substantial. The CRA that my colleagues are offering will be directly responsive to the needs of this very, very important group of American innovators and entrepreneurs. And that's why I so strongly support it and urge my colleagues to do the same. Thank you.
So there you have it. We heard both Mark Warner and Tim Kaine, our senators from Virginia, speaking on the Affordable Care Act there.